Welcome to part 2 of Got Shoulder Pain for the Friday Value videos. In the introduction, talked about common diagnoses, common treatments, causes, and so now I want to go into each one of those in a little more detail for the next few weeks. So today we're going to talk about common diagnoses for shoulder pain, and I'm going to talk about just really briefly each of these items here. So rotator cuff. I admit that this is probably one of the things that frustrates me the most is how much the rotator cuff gets beat up, exercised, stretched, strengthened, all kinds of stuff. Like it's the only part of the shoulder. Yes, your shoulder is the most mobile joint in the body. The rotator cuff is designed to keep it more stable in the joint. However, there are only 4 muscles. They're fairly small, and they're meant to help improve stability. They're not there to provide strength or any kind of other real functional tasks or function, right? You've got 14 other muscles that provide strength and power for your shoulder girdle, and the entire rest of your body provides indirect interaction for proper, healthy, pain-free shoulder function. And I won't go into it right now, but I have helped people completely resolve shoulder pain and never touch their shoulder because we addressed the areas of the body that were the cause. We didn't just beat up the shoulder, which was the victim. Okay, moving on. Impingement syndrome. Now, this can also be called subacromial impingement. Bursitis is often occurs here as well because you've got a bursa that sits here, subacromial bursa, which is meant to help the tendons glide and the muscles to move a little bit better in really mobile, well-used areas of the body. And of course, the shoulder is a very well-used area, right? Other names for impingement: painful arc syndrome, supraspinatus syndrome, swimmer's shoulder, thrower's shoulder, anybody who uses their shoulder a lot. And what happens is the rotator cuff muscle can get irritated as it passes through this area beneath the acromion as you go to do overhead arm motions, because the humeral head of the arm bone can kind of jam it. Now, why does it only start jamming it when you're in like your 30s, your 40s, your 50s, right? And it doesn't happen with everybody who has swimmer's shoulder. It doesn't happen with everybody who throws a ball. So why does it only happen with some people? There's a question, right? Okay. Now, moving on to osteoarthritis and shoulder pain. I don't know if you're aware of this or not, but the Arthritis Foundation, traditionally thought of as a disease related to aging and wear and tear, it's now recognized as they're still calling it a disease of the whole joint. And osteoarthritis is the most common form of arthritis. And the Arthritis Foundation reports that it does not yet have any drugs that can slow or modify the disease. Okay, so it's inflammation, right? The Stanford University School of Medicine did a study, and they found out that the primary cause of joint damage is not compression or wear and tear, it's chronic inflammation. So if it's chronic inflammation, what's causing chronic inflammation? Let's address that. Then maybe we can reverse or stop arthritic changes going on in the joints. Well, the number 1 cause of chronic inflammation is the standard American diet. And the reason that food can promote chronic inflammation in the body is because of excess arachidonic acid. And I've done lots of other Friday Value videos. I've talked about this, but just very briefly, it's very high amounts of this are in animal foods. You get it directly. Your body will make all the arachidonic acid it needs from plant foods. It'll convert it, the plant oils to what you need. So, I'm not saying you have to be vegan. I'm just saying if you're consuming animal foods 3 times a day, 7 days a week, you are promoting chronic inflammation in your body. So you may just do a little experiment, kind of stop animal foods for a few days and see if you feel better. I'm not telling you have to go 100% vegan, but do a little experiment, right? It does contribute to inflammation. It stimulates production of pro-inflammatory chemicals. So when somebody wants to advise you to treat any diagnosis that you've been given, your question to ask is, how effective is it at fixing my problem, and what are the risks? Very important question to ask. And if you're not addressing the cause of the problem and you're only treating a symptom, you're not really resolving the issue. Okay, I look forward to continuing this for at least 3 more Friday value videos. See you next week.